licensed health insurance and life insurance agent. And I will be talking today about the very basic, what we call Medicare ABC and D, right? Four basic stuff that it's throwing a lot of our seniors into serious confusion, especially in this time of the year. The four parts of Medicare A, B, C, and D. So in this edition, I'll just talk on those four parts really simply and break it down for everyone to understand, like, it should be. Because I know right now everybody's overwhelmed. It's very natural because Medicare is offered by private insurance companies. Medicare is offered by private insurance companies as well as Medicare itself, right? So the private insurance companies will definitely want to get your attention, right? And this is exactly the time they'll try to get your attention the most because it's the annual election period or enrollment period, as it's called. It runs from October 15th through December 7th, which is the deadline for everyone who's a beneficiary to Medicare to enroll. So it's but natural that all these companies are looking to get your business, so they want you to enroll with them, and then they will have your Medicare assigned to them, and then they will provide you those Medicare services or the health services as it's actually designed to do. So what I would do today is actually look at those four parts of the Medicare and how you can use them to your best advantage. And of course, what you need to look out for when you're looking at or shopping for coverage in Medicare. So I will take it a very interactive and I would say more of a comparative approach. So I will put the various options that you have and compare them side by side as I explain those four parts of Medicare. So let's go ahead and start off here, which is the part A. So it's an A, B, C, and D. So I'm just going to define the four parts and then we'll look at them individually and makes more sense when we go through that together. So the very first part of Medicare is hospital insurance, or part A as it's called. So this will usually be designed to pay for your hospital, inpatient hospitalization, skilled nursing facility, home health care services, and hospice care. So that's what that part A is designed to take care of. And who gets part A? That's pretty much natural, given everyone or most people would get part A without a premium. So you would qualify for that just by turning 65. So that is provided by Medicare. So no other company, no private organization can provide you a Part A. So I need to make that distinction clear because I know a lot of people, especially the new aging into Medicare, get a little too confused with those different parts. So I would make those distinctions each time they come up. So Part A is only provided by Medicare. So nobody else can provide you a Part A. You cannot buy that from a private insurance company. They cannot provide it to you. It's only Medicare that gives you Part A. And the Part B, which is medical insurance, right? Medical insurance will look after your doctor's visits, your medical supplies, outpatient services, and preventive services, right? Those are the things that are covered under Part B. Again, this is another part of Medicare that is only provided by Medicare. So nobody can provide you a Part B but Medicare itself. So that's just recap there. Medicare Part A and Medicare Part B is provided only by Medicare. Nobody can give you a Medicare A and B except Medicare. So get that really simple and straight. So that's what your Medicare practically is, right? Your Part A and your Part B. Now, Part B does come with a premium, right? So you would have a premium that you would pay to get your Part B on a monthly basis, right? A monthly premium. And that you pay directly to Medicare. So it doesn't go through to any insurance company. You would always pay that directly to Medicare. And the premium for the plan year 2022 for standard coverage for Medicare is $148.50. Well, if you do have an income related monthly adjusted amount, or IRMA as it's referred to, then you might have an extra to pay, which could be between $70 plus or $76 plus the 148. So that's for people who have a certain level of income. So if you have an income level of over 169,000 to over 500,000, you can see your Medicare Part B premiums go up by $70 more for people with income over 169,000 who qualify for Medicare and want to use Medicare. And for those with over 500,000, you can see that go up by almost $76 more. So that's something you also want to watch out for. You would also get that bill directly from Medicare, or they would actually deduct it straight away from your Social Security checks. Now, recap one more time. The Part A and the Part B is only provided by Medicare, so no private organization can provide you Medicare Part A or Part B. They can assign it for you from Medicare, but they cannot provide it to you. So you would have to talk to Medicare or the Social Security Administration, or CMS as it's called, the organization that runs the Medicare and Medicaid program, CMS. They are the ones who provide you that. So no other organization or no private organization can provide you a Part A and a Part B. So you want to keep a very good understanding of that basic of Medicare. Now, once you have that basic, right, Medicare says they still require you to have what they call a prescription drug coverage. A prescription drug coverage is also referred to as Part D. So that will cover for your prescriptions, right? For prescription or drugs. If you were having drugs that you need to fill monthly and make sure you stay healthy, it's provided under Part D or a Medicare prescription drug plan. Now, there are quite a few of them out there, but you have to also make sure that the plan is creditable by Medicare, right? So it could be a plan and it's good, it provides you your prescription coverage. If it doesn't meet the basic that Medicare requires, then it's not creditable. That's what that means. So you want to check when you buy a prescription plan to make sure that it is creditable by Medicare. And that is also important. What is also important to remember here is when you have a Part D, it's a requirement by Medicare. So if you do not have it, once you become eligible, you can incur a late enrollment penalty, which is a 1% of the national basic beneficiary cost. That for 2022 is $33.37, 1% of the $3.37 on a monthly basis. So that can add up, right? Like $3 and some cents that you would pay every month extra just because you did not pick up a Part D prescription coverage. So you want to take care and watch out. Once you become eligible, you get your Part A and Part B that CMS will tell you about, or send it to you, or let you know about it. Once you have it, you are also required to get a Part D. Most of the time, they would offer you that through SilverScript, but it's always good to know that you can also get that on your own on a standalone prescription plan. That's if you, of course, want to maintain your original Medicare, which is the Part A and Part B, and then you add a prescription Part D in there. That way, you are all covered. The Part C, right, which is why I'm talking about it later on, is actually a combination of your Part A, B, and D, right? It's what we'll call a Medicare Advantage, Part C. So what that does is simply saying they take over your Medicare, right, from Medicare itself or CMS and provide it to you. And this is, of course, like I forgot to mention, the Part D is also private. So Part D can be provided to you only by private organizations. So is Part C as well, provided only by private organizations. So Medicare provides Part A and Part B. Private organizations provide Part D and Part C. So Part C basically is saying the private organizations or health insurance companies take over or assign your Part A and Part B from Medicare and provide it to you. So how would they do that? They would incorporate that into a plan, what they would call a Medicare Advantage plan. Most of the time, it will include a Part D in there. So it will have your A, B, and D. Sometimes it will not. So you want to make sure you're looking at a plan that has A, B, and D, right? That way you don't have to worry about anything anymore. Well, if it does, you're good. You don't have anything to worry about because you know you have all three things that Medicare requires and you're all covered. So what you really want to watch out for is in the Medicare Advantage plans, you want to make sure, right, that the coverage is, the coverage is good enough for what Medicare would. I mean, if Medicare approves a private organization to provide it, it should be good enough, but still you want to check to see what quality that company has, right? They have ratings from 1 star to 5 star. So that's another way for you to see how good a plan is. Use those ratings, try to see why a plan will be in a 5 or between the 1 to 2 star ratings and why another one is in a 5 star rating. You would understand basically that they're not providing the best of services. That's how they're rated, because of the quality of service they provide. That's another way Medicare kind of like evaluates the system. So you want to use that as a guide to understand what your benefits you can enjoy and how good a plan can be for you. And the other last thing I would like to talk about here, which doesn't belong to any of the 4 parts that I've talked about, which is A, B, C, and D, is what they also refer to as Medicare supplemental plans, or Medigap, right? Medicare supplemental plans, or Medigap. What that is simply, if you would keep your original Medicare A and B, and then you would like to assign some of that cost that Medicare doesn't cover, right? All those gaps that Medicare would not cover. You would assign that to a private organization as well in a plan called a Medicare Supplemental Plan, or a Medigap. They will now cover that remainder. Usually it's about 20% of what Medicare would not cover. They would cover that for you. So that will come in premiums that you would pay monthly, and the plan would pay the rest of your outstanding costs that Medicare doesn't cover. So I'm just going to use another quick talk here and compare the Medigap and the Medicare Advantage. So what is the difference? It gets really confusing. I had a client that I was, recently helping out to discuss what Medicare really is, and they had a Medigap plan, and they were just so confused. Why should they switch from a Medigap plan to a Medicare Advantage plan? And it just gets a little too confusing or overwhelming, especially when you get so much information overload, right? Right now, there's so much overload of information that you can get so overwhelmed and don't understand the basics. So I want to dwell a little bit on this because it's going to make it really easy for everyone who has who is a beneficiary to Medicare, or who is going to become beneficiary to Medicare, to understand what the differences are. So what the differences are in Medicare is Medicare and Medigap policies, Medicare Advantage and Medigap, or Medicare supplemental policies, are the Medicare Advantage assigns your Part A and Part B. So it's actually another way for you to get Medicare. Medicare supplemental, or Medigap, supplements your Medicare A and B. So it doesn't assign it, it supplements it. So you would still keep the same A and B that Medicare has provided. All you need is that supplemental plan to help cover for the parts that Medicare would not cover. So that differs from a Medicare Advantage plan in that the Medicare Advantage plan assigns your A and B, and then would likely add a D in there to get you all the 3 parts of Medicare that you are required to have to avoid any penalties. So that's a baseline difference between the two. So I'm going to talk about why, or what could be the advantage of one against the other. So what is the advantage of having an Advantage Plus, an Advantage plan, or a Medicare gap plan? So the Advantage plan is advantageous in that you are sure to have all the 3 things that Medicare requires you to have without paying different premiums. So you would have all the A, B, and D under one plan. Makes your life simple. If it's a good plan, right? If the premiums are okay with you, your co-pays are all right, your most of them don't have deductibles anyway. your maximum out-of-pocket is reasonable enough, your preventive dental, vision, and hearing sometimes will be provided as well on your Medicare Advantage plan. So that's the kind of advantages you will see. It comes with a lot of benefits as well that you would still have to go out there and buy if you were under a Medicare plan. So in a Medicare plan, they only say they will cover those things that Medicare will not cover. So you would still have to get to pay premiums to get a Part D standalone plan, pay premiums to get maybe a dental and vision coverage, and then you are still having the Part D premiums to pay, and that premium for the Medicare or Medicare supplemental plans to pay. So those are the basic differences I would say would be attractive for a Medicare Advantage plan over a Medigap plan, because it has most of those things all combined in one for you, and you don't have to get yourself so worked out and stressed out to understand how and what you have to pay every month, because all those things are on monthly premiums. And as a retirement, I don't see you spending all your retirement benefits and income, fixed income, on premiums for prescription drug, supplemental plan, and the Part B, right? That adds up, takes away a lot. And you have to also cover your prescriptions most of the time, right, when you refill them. So those things take away money from your pocket. You want to see everything that will keep money in your pocket. That's what you're looking for in the Medicare plan. So the Medicaps are attractive in their own sense that they provide you flexibility, right? Flexibility is the advantage. They give you the flexibility of going to whichever doctors you would like, whichever hospitals you would like. They cover most of your co-pays, right? So most Medicare Advantage plans will have co-pays and co-insurance. So you would have to still pay a co-pay and a co-insurance besides a premium if it has a premium. A Medigap plan will cover those things for you. So that's why they actually are charging higher premiums you typically. And usually the lesser your co-pays, the lesser your copays and co-insurance and deductibles, the higher your premiums in a Medicap plan. So you can see how that trade-off works, right? So that you are paying less in terms of copays and co-insurance if you pay higher premiums. So that's pretty much how that works. If you're interested in a plan that will cover most of your costs, that you don't have to put anything out of your pocket, then a Medigap is for you. It keeps your Part A and B, and you have to buy a standalone Part D and maybe a dental and vision and hearing as well. So those are things you would have to consider. But in that sense, it makes a lot of sense for people who, for example, know that they would have a higher cost for care, right? If you know you have to see doctors too often, go into hospitals too often, then it makes sense to pay off that, take a Medicare plan, which will cover most of those costs, and you don't have to worry about that. But if you know you're living your healthy life and you don't have to see doctors that often, you don't typically get too much in, health situations throughout a year, and you know you can keep a healthy lifestyle, why not? The Medicare Advantage is ideal because you know you're keeping charge or control of what you can spend on your medical procedures. When you go see a doctor, they will tell you exactly what your copay will be. And if you see a specialist, all those kind of stuff will be also, in the copay format. So everything has its advantage. The main thing you need to keep in mind here is if you have a Medicare Advantage plan, you cannot have a Medicare supplemental plan. So those don't work together. And it's illegal, as a matter of fact, for anyone to sell you a Medigap plan when you're on a Medicare Advantage plan. So you have to trade one for the other. You can have both at the same time. So just to recap here before we wrap up, the things that you need to watch out for in a plan is look at the three parts of what you will pay in a Medicare plan, which is your co-insurance, your co-pay, and your deductibles, right? Those are the three things you want to watch out for. How do you pay for those things? How are they structured under your plan? If you see that the cost for these three aspects are a little too high, then you might want to consider, is it worth it? How is it worth it? Is it worth it for you to put in so much in a premium and get less of the co-pays or the co-insurance deductibles, or pay lesser premiums and do more co-pays and insurance and all that kind of stuff? So those are the basic things you would look for when you shop for a plan, and make sure that you're making the right decision based on what your needs are. So it's not really going to come down to, they say it's a $0 premium plan and you jump on it because you don't want to pay a premium. Keep in mind, that's just a way of saying, well, you would have to pay that in co-pays and co-insurance because you have little or no premiums. So that's that trade-off you want to keep a good eye on. And before I wrap up here, I just want to say, for anyone who has issues or questions, the first place I always recommend to go is, of course, Medicare.gov. That's your number one place to get first-hand information, accurate information about how Medicare works. What do you need to know about Medicare? You would find all of that information in there. And of course, I am very willing and ready to assist anyone who comes across this video and have questions about how to cover their Medicare. I can happily help you out, answer any questions you might have, and, take care of that for you. So my number, of course, is 1888. That's the man who builds the house. 1-888-239-569-9229. Say hello, goodbye, everybody. So that's all I got for you today. It was awesome.